Because of the pandemic, some people may be putting off yearly checkups. Many exams can be done virtually, but when it comes to things like cervical cancer screenings and mammograms, patients will need to see a physician in person. Jessica Edson talked with some healthcare providers about whether patients should hold off on exams like pap smears and clinical breast exams.
The idea of going into a healthcare facility and possibly interacting with a sick person is a scary thought for many right now.
From pediatrics all the way through geriatrics, there are a lot of different screening testing that has been seen by patients and, frankly, by providers as something that putting off is reasonable.
Kinney says she is seeing fewer patients for things like routine pap smears, mammograms, and breast exams. She is, in fact, encouraging patients to wait if possible on these checkups. While many may believe they need these exams done annually or biannually, this isn't the case. For example, mammograms can be put off another 3 to 6 months for the average patient.
It's not necessary all the time to get your pap smear, exactly the day of. The pap smear schedule isn't every year like it used to be. It's every 3 to 5 years, kind of depending on what your previous result was.
Traxler with Planned Parenthood says their clinics are encouraging patients to wait if they feel that is what is best for them.
Listen to your body. If things seem to be going exactly the way that they were before, your periods are normal, your birth control is working for you, you're not having any symptoms, you haven't increased your sexual risk in any capacity, it is completely and totally appropriate to put things off until you personally feel like it's safe to go in to see your provider.
And Kinney says even if you've had an irregular pap smear in the past, it's not completely necessary to risk exposure to the coronavirus by coming into the office.
It needs to be done, but again, because the interval is such a long period of time and that disease process takes such a long time to really affect a person, I have not felt that I put patients in danger. Is it hard to explain that to people? Yes.
At the end of the day, both physicians say if you feel like there is an urgent need, call your doctor and talk to them about the issue. Jessica Edson, 3 News Now.
Both Nebraska Medicine and Planned Parenthood are offering several services through telehealth, such as birth control refills and STI testing.